Okay, so let's dive in. Imagine this. You've just moved back to Scotland. It's mid-December 2024. You're settling back in, that mix of new and familiar.
Yeah.
And then, bam, the very next day, toothache.
Oh, no.
And not just any toothache. It's this crowned tooth you've had for ages, one you thought was sorted years back.
Right.
So your first thought is, find a dentist quick, like you might say in Shanghai or Taipei, where it often feels a bit more straightforward.
And that's really the hook from the source material you shared, isn't it? How that simple, everyday problem, a toothache, suddenly highlights all these unique things about the UK healthcare system.
Exactly.
This isn't just about acute, really. It's a deep dive based entirely on your account and the research that came out of it into how you actually navigate the NHS in Scotland.
Yeah.
Specifically, dental care, late 2024, early 2025.
Right. So our mission here is to take that personal story as our jumping off point. We're going to unpack what you found, what your digging revealed about the NHS, some of its, quirks and challenges, and what that might mean if, you found yourself in a similar boat.
Okay, so let's trace it back. Mid-December 2024, you're in Scotland. This toothache kicks off, the one with the crown.
Almost immediately, yeah.
And it makes sense you'd be surprised, right? Given the history you thought that tooth had.
Totally. But the first hurdle, as you found out pretty quick, wasn't just finding a dentist. It was this whole thing about needing to register.
Oh, yeah. The UK system. When you move area, you generally need to get on the books with a local GP for your general health, and separately with a local dentist.
It's not always just walking in off the street.
And your source really paints a picture of how big a barrier that can be.
Yeah.
You mentioned your town, over 3,000 people,
Yep.
but only one dental clinic. One. And the crucial bit, you'd already been trying to register there since September 2021.
2 years earlier.
Yeah, you were on a waiting list because they were just completely full. No capacity.
It's wild. You mentioned how getting a spot often literally relied on someone else moving house or, passing away.
Grim reality.
But you finally got that call, managed to actually register on January 8th, 2025. But remember, the pain started way back in December.
Right, which leads to that really tough period you described, trying to cope with the pain before you were even registered anywhere locally.
Yeah.
Finding urgent help when you're not officially in the system locally is tricky.
It meant traveling. You said you had to drive, over 45 minutes?
Yeah, something like that. To an emergency dental clinic in a bigger town nearby, just for some kind of temporary fix or relief.
Okay, so you get to this emergency clinic. What happened there?
Well, according to your notes, they took an x-ray. The team looked at it, but maybe surprisingly, they didn't pinpoint anything specific that needed immediate intervention based on that x-ray.
So what did they advise?
Basically, keep doing saltwater rinses, take painkillers.
Oh.
Yeah. You were sent home. The pain was maybe dulled for a bit, but the actual problem, still there, unresolved.
Okay, so let's fast forward. January 8th, 2025, registration day. You're finally on the books with your local dentist. Must have felt like progress.
It did, definitely. But then came the next sort of reality check.
Which was?
Just because you're registered doesn't mean you get seen straight away. That first routine appointment, the initial checkup, you had to wait for that too.
Ah, right. How long was the wait for that first consultation?
The earliest slot they could give you was March 4th, 2025.
March 4th. So nearly 2 months after registering in January and months after the pain actually started back in December.
Exactly. So you're just living with it, still managing the toothache day-to-day, saltwater, painkillers, just waiting for March 4th to roll around.
Okay. March 4th arrives, you finally get into that local clinic for the first proper appointment. What was that like?
You described it as, a pretty thorough initial exam. The dentist went through everything, checking all the teeth, charting them, did a cleaning, the standard new patient stuff.
Okay.
But the key thing here, they took a new x-ray of the problem tooth.
Why new? Didn't they have the emergency one?
Apparently not. Your source mentions the systems aren't linked up. So the December x-ray wasn't accessible.
Huh.
And this x-ray, the new one, it showed suspected decay right there under the crown.
Uh-huh. So they found something.
Yes. And you noted the dentist seemed a bit surprised it wasn't flagged back at the emergency visit.
Yeah, that does seem odd. Maybe a disconnect between the emergency focus and the routine check?
Could be. Anyway, based on this new finding, the path forward was clearer. That crown had to come off.
Right.
See how bad the decay was, figure out if a root canal could save it, and then potentially a new crown eventually. Progress, sort of, but...
Not immediate action, right. I'm sensing a theme here.
You got it.
Right.
That procedure, removing the crown, assessing the damage, it couldn't happen right then and there during the consultations.
Of course not.
You had to book another separate appointment just for that specific job.
Okay, so more waiting. When could you get in for that appointment?
When you went to book it, the earliest they had was April 15th, 2025.
April 15th. So over another month after they actually figured out what was likely wrong.
Yep, another month. By this point, you probably felt like an old hand at this waiting game.
I imagine so. Just managing the pain, ticking off the days until April 15th.
So the day finally comes.
Yeah.
April 15th. You're back in the chair. They took another x-ray just before starting, you said.
Yeah, seems standard procedure.
Then off came the crown.
And the verdict.
The decay was severe, really bad. The tooth just wasn't salvageable.
Oh, wow. After all that.
Yeah. So on that same day, April 15th, the decision was made and the tooth was extracted.
End of the road for that tooth.
That specific tooth, yes. And then the next step, or rather the next wait.
Let me guess. More waiting.
You got it. You were told you'd need to wait at least 6 months.
6 months? For what?
For the extraction site to heal properly before they could even start thinking about options like an implant or bridge or whatever comes next.
Okay, let's just recap this timeline because it's kind of mind-boggling. Pain starts late December 24, early Jan 25. Emergency visit, no real solution. Register Jan 8th. First consultation March 4th, finds the issue. Procedure booked for April 15th.
Where the tooth is finally extracted.
So that's roughly January, February, March into mid-April. About 4 months from noticing the serious pain to getting the tooth removed.
4 months. And you mentioned in your notes how different that feels compared to getting similar things sorted in other places you've lived.
Definitely. And going through that whole drawn-out process, it clearly made you want to understand why. Why does the UK system work this way? Which led to the research part of your source material.
Yes, exactly. And that research points to some fundamental aspects of the UK system. One key thing is the referral pathway.
Right, the GP gatekeeper thing.
Pretty much. For most health issues that aren't emergencies, your first stop is your GP general practitioner. They assess you, and they decide if you need to see a specialist or go to the hospital.
Which is different from some systems where you might be able to go straight to, say, a cardiologist if you think you need one.
Correct. The GP manages a lot: routine checkups, common illnesses, vaccinations, sexual health screening, pregnancy tests, that sort of thing.
Okay.
And it's crucial, as your source highlights, that general medical care through the GP, dental care, and even optical care, eye tests, glasses, often through high street opticians, they're largely separate systems.
Right, so you had to register for dental separately, navigate that system on its own.
Exactly. You couldn't just go to your GP about the toothache and get referred directly to the dentist. You had to enter the dental system itself.
And during all this, your personal feeling, backed up by the research you shared, was this sense of, well, not enough doctors or dentists around, especially outside the big cities.
Yeah, that perception comes through strongly. Big cities might have more resources, but a lot of the UK population lives in smaller towns or commutes from them. So you can get these areas where access feels really stretched.
Which brings us to the policy background you dug into. This wasn't just bad luck. There's a history here, right?
Yes. Your source points to a long-standing policy going back to around 1999 under Tony Blair's government that intentionally limited the number of places in UK medical schools, capped the intake.
Why would they do that? Seems counterintuitive if you need more doctors.
Well, the reasons cited, according to your source, were things like ensuring the quality of training, making sure there were enough supervisors, resources, clinical placements for the students.
Okay, that makes some sense.
And also cost. Training a doctor is expensive. The figure you quoted was around £250,000 per doctor. So the government was apparently cautious about just massively expanding the number of publicly funded training spots.
Right. £250,000 per person. That's a significant investment.
It is. And looking at the numbers you found, you can see the effect of that historical cap. Medical school admissions, hovering just over 10,000 a year recently. Like 10,203 for 23-24, up slightly to 10,417 for 24-25.
Small increases.
Tiny increases, really. There's a projection for about 10,767 for 25-26, which includes 350 specifically designated new spots, but still not huge leaps.
And what about dental schools? Because that was your immediate issue.
Even lower numbers there, across the whole UK. Around 11,015 admissions in 23-24 actually dropped slightly to 11,109 for 24-25.
Wow.
And for Scotland specifically, that 24-25 target was just 155 dental students total, with very few of those spots open to international students.
So the core point from your sources analysis is that for, what, over 20 years, this policy of capping training numbers means the homegrown supply just hasn't kept up.
Hasn't kept pace with population growth, immigration, increasing healthcare needs. Yeah, that's the argument presented.
And it's not even just about getting into med school, is it? Your source mentioned other factors.
Right. Not everyone who graduates medical school becomes a practicing doctor in the UK long term. They have to get through further training, like the foundation program years, which also have bottlenecks.
Okay.
And then some doctors trained in the UK end up leaving, maybe for better pay, different working conditions, opportunities abroad.
Do we have numbers on that? How many leave?
Your source cited a figure. Over 4,000 NHS doctors either left the UK permanently or stopped practicing medicine in the UK back in 2022 alone.
4,000 in 1 year. That's a lot.
It is. And it explains another key point your research highlighted. The NHS relies really heavily on doctors trained overseas.
How heavily?
As of 2022, over 37% of doctors registered to practice in the UK were trained internationally.
More than a third. Wow. Where do they mainly come from?
Your source mentioned large numbers historically coming from places like India and the Philippines, among others.
And how does that work? How do doctors trained abroad qualify to work in the NHS?
Well, your source briefly outlines the main routes. They need to register with the General Medical Council, the GMC. Often that involves passing exams called the PLAB tests, Professional and Linguistic Assessment Board.
Sounds tough.
They are. Written and practical exams, plus proving high-level English skills, usually through tests like IELTS or OET, meeting really high scores. There are also some pathways for direct recognition if your qualification is from certain specific countries or if you have recognized postgraduate qualifications.
And there's a special visa for them too, right?
Yeah, the healthcare worker visa designed specifically to bring these professionals into the country.
Okay, so pulling all these threads together, your personal story of delays and waits, the historical policy limiting UK training spots,
Right.
doctors leaving the UK, and the significant reliance on international recruitment. And it starts to build a picture, doesn't it?
It really does. It contextualizes the experience. Your source notes that, look, long waits and staffing issues are common complaints about the NHS. Your dental saga was kind of a validation of that lived reality for many just within one specific part of the health service.
Yeah. And one of the most maybe insightful interpretations your source offered was this idea about the system's overall focus. What was that again?
The interpretation was that the system, made partly by design, partly by necessity, given the resource constraints, seems heavily geared towards prevention.
Prevention rather than reaction.
Kind of. Think about the GP model again. A lot of their work is preventative health checks, screening, identifying risks like high blood pressure early, giving lifestyle advice, smoking cessation support, trying to stop problems before they become acute.
Okay, I see. So the focus is on keeping people healthy in the first place.
That seems to be a strong emphasis. You could frame it, as your source does, as putting quite a bit of onus on individual responsibility. Take care of yourself, make healthy choices, use the preventative services.
And if you don't, or if something acute happens anyway?
Then you enter the reactive pathway, the emergency clinics, the waiting lists for procedures. And as your experience showed, that reactive pathway can be slow and frustrating.
There was also that point about the system feeling rigid, slow to adapt.
Yeah, the observation that this core policy around training numbers has been in place for over 2 decades without a major overhaul suggests a certain inertia, perhaps. A system that's maybe not as agile as some might like.
And finally, you had that interesting cultural observation.
Yes, just the sense that maybe because this has been the reality for a long time, many people in the UK seem, well, quite patient. Accustomed to waiting, perhaps more tolerant of delays than people might be in other cultures or systems.
So, wrapping this up, it started with a toothache when you arrived back in Scotland.
Yeah.
And it turned into this 4-month journey that basically peeled back the layers of the UK healthcare system. Registration hurdles, long waits just for basic appointments, let alone treatment. And then digging into the why and finding these historical policies limiting training, the reliance on overseas doctors. It really was a deep dive prompted by that initial painful experience you documented for us.
It definitely connects the personal experience to the bigger systemic picture. And it leaves you thinking, doesn't it? If every healthcare system involves trade-offs between immediate access, cost, quality, preventative focus versus reactive treatment, what does a system like the NHS, which seems to really lean into prevention but requires significant patients for non-emergency reactive care. Tell us about its core values, or
Yeah.
maybe the compromises it's had to make.
That's a really good question to leave people with. And following the lead of your source material, maybe we can invite listeners.
Yeah.
If you've had your own experiences with NHS waiting lists, or maybe you work in the system, perhaps as an international doctor,
Yeah.
reflect on this story, this deep dive. Does it resonate? What are your own thoughts on navigating this complex system?